Chapter 4: Adhering to Principles of Infection Control. Infection control is one of the most important responsibilities of a caregiver. Preventing infections protects you, your patients, and the entire healthcare environment. Infections spread through a process called the chain of infection. Breaking any link in this chain stops the disease from spreading. The chain of infection has 6 links: infectious agent like bacteria, viruses, and fungi; reservoir like humans, surfaces, food, or water; portal of exit like coughing, open wounds, or bodily fluids; mode of transmission such as touch, air, droplets, or contaminated objects; portal of entry, which includes eyes, mouth, cuts, or even medical devices; and finally, the susceptible host, like the elderly, already sick, and immunocompromised individuals. Caregivers must follow 2 types of infection control precautions: standard precautions and transmission-based precautions. For all patients, wash your hands frequently, wear gloves when handling bodily fluids, and use proper disposal for contaminated materials. For specific infection scenarios, use contact precautions, droplet precautions, and airborne precautions, as outlined here. Personal protective equipment, PPE, keeps infections from spreading. Always use the right equipment for the situation, bearing in mind these pointers on screen. Always remove PPE in the correct order to avoid contamination. Hand hygiene is the most effective way to prevent infections. It is imperative that you remember to wash your hands in all of these scenarios. Remember to wash for at least 20 seconds with both soap and water. Bloodborne pathogens like HIV and hepatitis B can spread through infected blood. Wear gloves, dispose of sharps properly, and report any exposure you may have had immediately. Early detection helps prevent outbreaks. Watch for signs of infection and report them to a nurse or another team member immediately. Some of the signs of infection are fever, redness, swelling, persistent cough, unusual discharge, and strange rashes. However, you should read Chapter 4's full text for a complete overview. By following infection control procedures, you protect yourself, your co-workers, and your patients. Always practice safe hygiene and follow facility guidelines. Read the full chapter to get a fuller understanding of this subject in preparation for the quiz.